वो नीचे वाले फॉलो पे चलता नहीं है ना, नीचे प्रेशर
अभी तो कॉन्वोकेशन वाला एक करके वहाँ पे लगाएंगे। ठीक है।
suggestion. As per the brief entire process for participating 2 days, total 8 existing medical programs that need innovative solution and often focusing on the issues faced by healthcare professionals, patient and hospital systems. Second, form the interdisciplinary team. Third, understand and define the problem. Fourth, brainstorm novel solutions. Engage in brainstorming sessions to generate a wide range of creative solutions to the problem. Fabricate and test a prototype. Turn the concept into a tangible prototype that can be tested and iterated upon. 7. Preparation the presentation. And 8. The final round pitch to the jury panel. Doctor from government as well as private hospital, industry persons, professional to mentor and help the participant during hackathon. I wish to all participants for best learning, collaborations, noble outcome and memorable KIET. Thank you very much. Jai Hind, Jai Bharat.
Thank you so much, sir. Further now, I would like to invite Mr. Saurabh Kumar, General Manager TBI, to tell us a brief on participation.
Thank you, ma'am. Greeting to the dignitaries on the dais and participants. I am here to brief the summary of the participation, and we have received from the institute as well as outside the institute. So out of that, we have received total participation from 12 institutions, and total outside institutions are 11, and states covered, 2 states are there, and total registration is 1 area. And we have participation in biomedical, those who have reported on time, 64, CSIT 27, EE electrical department 18, mechanical 25, electronics and communication 16, and outsider out of them is 36 plus. And this is the summary of the participation. And thanks to all.
Thank you so much, sir. Now we would like to present an oxy plant as a token of respect to our Honorable Chief Guest, Dr. Nandan Kumar Srivastav sir. And to do the honor, I would like to request our Honorable Director General, ma'am. Varshney sir, and I would like to oxy plant to our jury member. We are honored to have you. For the further oxyplant presentations, I'd like to invite Dr. Vibhav Sachand sir, and I would request the student to please stand. Sir, Dean Mechanical. To have an oxy plant as a token of respect from our side. Next, I would like to invite Dr. Sachin Rathore sir, Head Innovation Center, to please receive an oxy plant from our side. 10:24.
The time has come up for Medha 2024.
This time we have come up the medical device hackathon. It's a great opportunity for all the students. I warmly welcome all the participants, the teams of the doctors in the event of Medha 2024.
आइए मिलकर विकसित भारत 2047 की तरफ आगे बढ़े। जय हिंद।
That was indeed an amazing video. Okay, now I would like to invite invite all the dignitaries present over here to kindly proceed for the lamp lighting ceremony. So can we please have you? Now I would like to invite our Honorable Director General Ma'am, Dr. Preeti Bajaj, Chief Guest of the day.
Honorable Chief Guest, Dr. Nalin Kumar Srivastava, Director Innovation and IPR Division, Ministry of Electronics and Medha, New Delhi. Joint Director, Dr. Manoj. Dr. Vaibhav D. Narengi. Dr. Abhinav. Saurabh, General Manager TBI. All heads of the year and involved actively the backbone of the campus for academic and from the department as well. The esteemed jury members from the industry, the industry invited, overwhelmed the great response to this activity. Belongs to Professor Ravi from IIT Bombay, a professor from mechanical engineering. Many centers who I am very proud institutes are now leading his team, Professor I, who's achieved today and tomorrow you are going to achieve first. It is only ideation. So the problem statements from industry would be shared with you. What you need to do, what is important is team dynamics. We will be randomly selecting the teams which will have 2 medical students, 1 mechanical engineer or engineering student, right? 1 computer science, 1 electronics or electrical. The unique combination under the mentorship of teachers would work for next 36 hours or at least 24 hours, and tomorrow at the same time we'll be here back to this CRPC hall along with your prototype, your ideation, your sketching and final your pitch presentation as well. So please do remember that you have to watch all the videos, the problem statement very carefully, and you have to give your preference what you want to do. The selected presentations or the teams would have opportunity to get an internship at IIT Bombay. Some good teams can be taken up as an pre-incubation. There would be many awards which we thought of, but it's all under, it could be best idea, it could be best design, best prototype, best commercialization and whatnot. The prizes are many, probably teams are less. So please give your best in next 24 hours, and we all are going to be in this campus, at TBI, at your workplace. So when we started with, we were not sure how it is going to happen. But thank you, the team. I have seen immense potential. I don't have words for the team who all the heads came from their departments, the team members, the faculty members. In no time, within a week's time, we have hosted, we got a huge response. We have to say sorry to few participants who reported little late. IIT Bombay allows 40 students for this competition, but through external funding, we tried our best and we have ensured that 150 participants participate over here. Out of 150, I'm sure at least we'll be getting top 50 who can participate in different events and we can take them to the next level. The next 3 steps are going to be development, deliver and deploy at IIT Bombay, which is a 5 days hackathon, medical hackathon, named as MEDIC. I really wish that many participants of ours participate in this MEDIC. There is no limitation on number of participation, but yes, there is a value for innovation and the prototype and your ideation, what you do. Your design thinking and your, how you take up that problem statement and challenge from the industry. Without the leadership of Dr. Sachan and Saurabh, this would not have been possible. In no time, two of them, they have taken ownership. Abhinav, Dr. Abhinav's team have, in 1 day, they have developed the curated videos. All sponsorship when we started with, I had no finances in my hand and Neeraj was there, so Dr. Neeraj has done in no time. Medical students, how they can be involved and how the problem statement comes. So Dr. Nagaraj was there, and without mechanical, nothing works over here, although this is the era of digitization, but still I would say I support the core. So Dr. Ashish was there, and then the whole team of, and without my knowledge, silently a leader who was working behind this was Dr. Manoj, and Manoj was there all the time without letting me know, but the processes were flowing and everything was done in minutes. So thank you team. Let's hope this hackathon to be a big success. Next 24 hours, you are here, I am here, and the whole team is going to be here. With this, Bigul abhi baja hai, agaz abhi baki hai. Thank you so much and expecting a lot of things. Thank you so much.
Thank you so much, ma'am, for those amazing and motivational words for us. Now I would like to invite on the podium our Honorable Chief Guest of the day, Dr. Nandan Kumar Srivastava sir, Director Innovation and IPR Division, Ministry of Electronics and IT, New Delhi, for his address session. Can we all welcome him with a huge round of applause?
A very good morning to all of you. A very enthusiastic and very proud moment for me. Every time when I am here in KIET, I see the hall, with full of energy, full of those ignited minds are there. The passion is there to do something. The passion is there with your Honorable Director Ma'am and entire KIET team. It's really very overwhelming. When we started, it's a long journey. It's a long journey with KIET and very long association of KIET with MITI. We have started with our earlier scheme, KIET 2.2 within KIET, and then stalwart Satyendra ji was there. So a long journey was there, and the journey is going in a very right direction. Every time, with the efforts of the incubation team, Saurabh ji and Director Ma'am and everybody, so the things are going in very right direction for KIET. And let me thank to the entire team for this medical electronics, this hackathon, which is also in the right direction and high time to create innovation and other things in this particular domain. Now, let me touch upon why innovation is very important for the country. Why everybody is looking for innovation. You see, be it Ministry of Electronics and IT, be it the Department of Science and Technology, be it any other ministry, MSME, DPIIT, everybody, entire central government departments as well as state governments, they all are you see, innovation is very important for them. Why? You even heard yesterday Honorable PM addresses US people. So there, today or right now we are having the 5th largest economy, and the target set by our Honorable PM is the 3rd largest economic position for the country. You see, if we want to achieve that position, we have to rely on innovation. There is no other way. If we have to have, there is a lot of economic indistribution in the country, you know well, economic as well as societal indistribution. So if we have to have a innovation-driven society wherein the technological background or technological upliftment is to be reached to the last mile of the country, last mile, जो कोने में खड़ा आदमी है, उस तक अगर हमें पहुंचना है, then we have to rely on innovation. There is no other way, and that's why entire central government, state governments, entire government of India, along with these institutions, we have to rely on innovation, and that's why these kind of efforts, be it hackathon, be it innovation-driven schemes, programs, be it the efforts made by KIET, these all are very important steps towards this. You see, now we are having UPI. This is the real kind of innovation, and with enablement of UPI, a lot of innovation is coming in the fintech domain. A lot of innovation is also coming in the healthcare and medical electronics segment, because you see, the penetration of internet, the penetration of financial transactions are very easy as of now. Even a click of things, you can financially transact. The internet penetration and these things are also very good. So these are paving the way to innovate, to think, and to make whatever you think is in the sketch, POC, and then the POC is going to be made to a product, and then market outreach is there. So this all is possible because of the unbearing, you can say, efforts of entire government, various departments, as well as these institutions wherein such things are taking place. My, you can say, best wishes to Saurabh, to Director Ma'am, and to all the participants who are here for this medical device hackathon. It's really indeed a very precious moment for all of you, wherein you have to make what Ma'am has suggested, these points. You have to make a proper pitch, you have to make a best case presentation, and then somewhat beta version of prototype or like this and to present that. That's really, you can say, very precious moment for me also. If we see whatever we have created a long back, if we see those institutions are working in right domain and right direction, then our energy is also boosted. Now, I'll quickly touch upon some innovative steps or some schemes which Ministry of Electronics and IT is doing for the promotion and for the benefit of young startups, because this all is full of, I think, young innovators, young teams, ignited minds. So one such scheme is called KIET 2.2. This scheme is already going on in KIET. It has in TIDE scheme map a total of 51 lakh is to be disbursed to startups in part of EIR, in part of investment, in part of product development. So this 51 lakh up to one startup it can be disbursed. I think TIDE is the Group 3 center for TIDE. So in TIDE, two distinguished things we are going to achieve. One part is a whole, you can say, journey of startups is to be touched upon. That's one part. And the other part is the capacity building of incubators. You see, the capacity building of incubators is also very important, wherein the nascent incubators are being handholded by the mature ones. There are various innovation or incubation centers who are fairly mature. You can name them like Sign, CIA, and Ahmedabad, and many more. So they are having, they are giving the additional responsibility of handholding the nascent ones, so that the holistic ecosystem is being developed in the country. And that's the another, you can say, objective of our TIDE 2.2 scheme. And that's why we are very passionate that this Group 3 TIDE 2.2 KIET Center is being handholded by, I think, SIIC IIT Kanpur. And IIT Kanpur is doing a lot of things for these kind of institutions, these kind of innovation entities. The another scheme which MITI has recently, you can say, announced, and the centers have been distributed. 65 such centers have been given the responsibility, and the name of the scheme is Genesis, Gen Next Support for Innovative Startups. Based upon the performance of KIET map, the center has been getting promoted to a Group 2 center. In Genesis, we have given the responsibility of KIET as Group 2 center, because you are now, I think, fairly matured with the efforts of the esteemed dignitaries and dais. And that's why, you see, right now in Genesis, various components are there, from EIR to product to market, and then to investment and market outreach, like that. But one important component which I want to address is the paid pilot component. This is being added first time, ma'am, in any of the innovation scheme. The paid pilot component is for them who are having the ready product with their innovation. Some purchase order or some, you can say, product purchase order kind of thing is there for that startup. And since the startup is a newer entity, they don't have sufficient fund to develop, let's say, 100 round of 100 such product is to be served for a institution or for a industry or for somewhere. So they are having the purchase order for 100, but they don't have sufficient fund to develop such kind of this number of products. So for that, if suppose you are having a purchase order, if you are having a service order for such number of product and your product is market ready, then this is valid or this is given the paid pilot component, and for that 40 lakh grant is being given under this component. So this is being added first time in the country for the startups. So in Genesis, the responsibility is given, and I think with this kind of efforts, definitely KIET is going to achieve the set targets for Genesis. The third important thing I want to just highlight is MITI has started recently MITI Startup Hub, MSH. MSH is being created under the plethora of Ministry of Electronics and IT. It's a nodal agency to support startups. Why MSH is being created? It's also very important to know, and it's a very interesting thing. You see, let's have an understanding of, let's say, some incubation center, let's say be it IIT Mandi in Himachal. So if suppose any of the startup of IIT Mandi or nearby incubator of Mandi is requiring something which is, let's say, SMT line or any other thing, and that is available somewhere in Kochi, probably in Maker Village or somewhere, which is known to the central agency. So if that particular request from that innovation center or directly from the startup would come to us as a central nodal point of MSH, so that request can be served. And that's the purpose of creation of MITI Startup Hub. I think more than 600 or 450 or 500 incubators are already connected onto the MITI Startup Hub. More than 6,000 technology startups are also connected. So we are going to serve the day-to-day issues of these startups, be it through any of the agency, be it through any of the incubator, be it through any of the resources we are having on our portal. And that's why it's a humble request to all of the budding entrepreneurs, budding startups. If you are going to register your startup, come on and join MITI Startup Hub. There is no foundation that you are going to support to any of the MITI Ministry of Electronics related schemes. No. If you are having a startup entity, you come and you join MITI Startup Hub so that various efforts, various initiatives and various things available onto the MSH portal can be suitably given out to you, suitably reach out to you. You see, startup and these things, the challenges are many more challenges are there, and timely address of these challenges is very important in terms of startup journey. And that's why if you come on to MSH, if you pop up your challenges, your issues onto the portal, definitely it would be served. And that's why my request from these budding entrepreneurs to come onto the portal. I think you all are there onto the portal and you are taking benefit of that thing. So let's again thank to the entire team, to the entire, you can say, dignitaries, to the entire director ma'am and their team for organizing this medical device hackathon. It's a very good thing. It's a very, you can say, the subject and the area is being chosen is very right. And let me thank to the participants also and giving my best wishes to all of you. Thanks.
Thank you so very much, sir, for those insightful words. We are delighted to have you among us today. Proceeding further, on behalf of the entire KIET family, let us present some mementos to our chief guest and to the jury members. To do the honors, I would like to request Dr. Preeti Bajaj ma'am to kindly present a token of appreciation to Dr. Nanil Kumar Srivastav sir, our honorable chief guest. We welcome you to KIET sir. Next, I would like to request Neeraj sir, Dr. Neeraj, to present a token of appreciation to Mr. Amit Varshne sir. Can we please have him on the stage? We welcome you among us, sir. Next, I would like to request Dr. Vibhav Sachan sir to present a token of appreciation to Dr. Neeti Mittal ma'am, who is here as a jury member among us. Can we hear it for her? Now we would like to have a clinical problem statement showcased through a video presentation by Dean CSIT, Dr. Abhinav Juneja sir.
Sorry, before Dr. Abhinav, I just thought of 2 minutes. We always say to, the CS department or, they should come out with use case study. So for this hackathon, there was a unique problem that team dynamics plays very important role, which is, as I said, 2 students of pharmacy, 1 electronics, 1 computer science, and based on the preference which you are going to give. Watch these videos and you have to give, everyone has to give 2 preferences. And Dr. Abhinav in no time, along with his students, immediately, I have worked for this Medha for last 7 years. So immediately, the Dean CSIT along with his students has developed the program in overnight, and he said, ma'am, it's all done. The kind of team dynamics you wanted. So that's a use case study, and that's what we wanted amongst all computer science students, that please accept the problem as and when need and develop the solution. And secondly, I would like to have special, which I have forgotten, for 2 people who I have seen them working day and night, and those are Sachin, head innovation center, and the way he was working, so I missed her name, although I could see, and from last 1 week, Sachin, another Sachin as well, and who was working day and night, and then Anu. So everybody is working, but then I missed few names, and I came with a long script, and then I did not refer my script. So sorry, apologies, but then many others who are working at backstage as well. Thank you so much, and Abhinav, over to you.
Respected dignitaries on the dais and off the dais, very good morning to all the participants as well who are listening to us for so long, and I'm sure that you are all very excited to be the part of this hackathon, and you will make a lot of learning during these 2 days. So before I start, I'd like to tell you that the problems that I'm going to share now, these have been curated and proposed by medical professionals and doctors, and I believe that your active brainstorming and participation in the hackathon will bring a lot of things that will be helping to all of us in the coming days. So before I start, I'd like to also mention that, as already conveyed to you during the rules of the hackathon, that there will be team formations which will be mixed of different domains of students. So after the presentation of different problems, we will share a QR code with you on the screen, and that QR code will lead you to a form, a Google form, wherein you can give 2 choices of the problem statements. Out of the problem statements, we are giving you here. Based on your choices and a good fit, we'll form the teams
and those teams will land to the solution of the problems that you have chosen. It is very important to mention here that once we form the teams, you please stay in your teams with your teams and try to find the best solution for the problem that has been assigned to you. So, not taking much of time, I would like to start with the problems now. The first clinical problem is monitor sleep apnea real time and send some kind of feedback to muscles to interrupt sleep apnea. The description of problem is develop a real time monitoring device for sleep apnea that detects breathing irregularities and provides immediate feedback to simulate muscles interrupting the sleep apnea episode. The solution should be non-invasive, wearable and capable of delivering timely interventions to prevent prolonged breathing disruptions. The device must ensure user comfort while offering accurate detection and feedback, aiming to improve sleep quality and overall health in individuals suffering from sleep apnea. So there's a video.
Heard the news. CPAP machines are outdated. Ready for a smarter solution? Sleep apnea disrupts your sleep by blocking your airway, leaving you tired and at risk for serious health issues. Current solutions like CPAP machines are bulky and uncomfortable. But imagine a system that monitors your sleep in real time and sends feedback to your muscles to stop apnea episodes instantly. This innovative approach could transform the way we manage sleep apnea, giving you better sleep and a healthier life. The future of sleep is here. Are you ready to wake up refreshed?
So the second problem is portable device using solar to sterilize medical equipment. The description of problem is design a portable solar powered device that can sterilize small to medium sized medical equipment in remote and low resource environments. The solution must be easy to use, compact and efficient, ensuring medical tools are sterilized safely and effectively using only solar energy. The video is
Like relying on electricity but still need sterile tools, then our solar sterilizer is your solution. Keeping medical tools clean in remote areas is tough, but with our portable solar-powered sterilization device, it's a breeze. Just lay out the foldable solar panels, pop your tools inside, and let the sun do its magic. No electricity needed. It's fast, sustainable, and super easy to use. Perfect for rural clinics and emergency teams. Because every patient deserves safe care. Ready to make a difference? Join the solar sterilization revolution today.
The third medical problem is high-grade fever is possible in various infections, but sometimes antibiotic drugs are not capable enough, so there is a requirement of non-medicinal approach to reduce the high-grade fever. Description of the problem is devise a solution to help the patient in high-grade fever due to various infections in reducing the degree of fever. The solution shall be augment the antibiotic drugs in lowering the body temperature.
70% of high-grade fever cases need better solutions. Let's dive in. High-grade fever can be a serious issue. Sometimes, even the best medications fall short. Imagine finding non-medicinal ways to tackle this. Your fresh ideas could save lives and transform health. Ready to take on a challenge that matters? Let's innovate and make a real difference together. Join us in creating solutions that count. creativity can change the world.
The clinical problem statement 4 is, a solution is required to protect the respiratory tract infection from bacteria and virus. Description of the problem is, such infections are very harmful for the patient and lead to complication in patients under treatment. Developed solution shall be able to kill or restrict the bacteria or virus. The link to the video of the problem is
looking for a way to stop respiratory infections. But how close are we? Students, your mission is clear. We need a breakthrough solution to protect our respiratory systems from harmful bacteria and viruses. It's a race against time to create a defense that kills or restricts these invaders. The challenge is immense, but so is the potential impact. Together, let's make a healthier future possible.
Clinical problem statement 5 is, an AI-powered decision support system. Develop an AI-powered decision support system that can assist physicians by analyzing patient data, including lab imaging and history, etc., and suggest possible diagnosis and treatments. The description of problem is, AI-powered decision support system for physicians. Develop a story-driven script that outlines how the tool helps doctors analyze patient data and provide diagnosis. An AI-generated image depicting a doctor using the system to be created to visualize the narrative.
Dr. Sarah had been on her feet for 10 hours straight. It was a typical day, patients coming in with complex conditions, each requiring detailed analysis and quick decisions. She knew that every piece of patient data, labs, imaging, history, held the key to the right diagnosis. But with so much information, it felt like putting together a 1,000-piece puzzle in record time. That's when she turned to the AI-powered decision support system.
Clinical problem statement 6. Remote patient monitoring for chronic diseases. Develop a user-friendly, accurate device for continuous monitoring of chronic conditions like diabetes and hypertension that can easily integrate with electronic health records and alert physicians in case of anomalies. The description of problem is, develop a continuous monitoring system for chronic conditions that seamlessly integrates with electronic health records. The system should track vital health metrics in real time and automatically alert physicians when anomalies are detected. It should be user-friendly, reliable, and capable of providing actionable insights to improve patient care. The solution should aim to enhance chronic disease management by enabling timely medical intervention and personalized treatment adjustment.
Conditions like diabetes and hypertension require constant management. Without continuous monitoring, patients are at risk of complications, and physicians may miss early warning signs of serious anomalies.
Clinical problem statement 7. Design a smart system or device that ensures patients take medications on time with real-time reporting to physicians, especially for elderly or mentally impaired patients. The description of problem is, create a smart system or device that ensures timely medication intake for patients, particularly the elderly and those with cognitive impairments. The solution should provide real-time reminders, track adherence, and report data to physicians for monitoring. It should be user-friendly, capable of alerting caregivers when doses are missed, and integrate with healthcare systems to support personalized treatment. The goal is to improve medication compliance, reduce health risks, and enhance patient outcomes through continuous oversight. The video is
to take your meds. Imagine the impact on someone who relies on them daily. For elderly or mentally impaired patients, keeping track of meds is tough. Missed doses can lead to serious health issues. Current methods, manual reminders, no real-time tracking. We need innovation. Imagine a smart system that automates reminders and reports intake to doctors instantly. Better health outcomes, fewer hospital visits, and a safer, healthier life for everyone. Smart tech is the future of medication.
Clinical problem statement 8. Build compact, low-cost imaging devices, example ultrasound X-ray, that can be used in remote or underserved areas to provide real-time diagnosis. Description of the problem is: design compact, low-cost imaging devices for use in remote or underserved areas. The devices should be able to provide real-time diagnostics, be portable, and function in low-resource settings. They must offer reliable imaging quality while minimizing operational complexity.
In this problem, you can use, instead of designing the low-cost device, if you are able to use your mobile for these applications, that's also welcome, right? Over to you.
The solution, they must offer reliable imaging quality while minimizing operational complexity, ensuring that healthcare professionals can quickly diagnose and treat patients without the need for extensive infrastructure. The goal is to improve access to essential diagnostic tools in regions with limited healthcare facilities.
Don't like waiting for change but still want to make a difference? Then join us now. Limited access to diagnostic imaging is a harsh reality for remote and underserved regions. High costs, bulky equipment, and lack of infrastructure make timely diagnosis a challenge. This impacts patient care drastically. But here's your chance to innovate. Join our biomedical hackathon and build compact, low-cost imaging devices. Help revolutionize healthcare and bring real-time diagnostics to those who need it most.
Clinical problem statement 9. Innovate in assistive devices for disabled or elderly patients that enhance mobility and rehabilitation, such as smart walkers, exoskeletons, or robotic aids. Description of the problem is: innovate and design assistive devices for disabled or elderly patients that enhance mobility and support rehabilitation. These devices, such as smart walkers, exoskeletons, or robotic aids, should be intuitive, adaptable to individual needs, and improve independence. The solution must offer real-time feedback, monitor patient progress, and ensure safety while promoting physical activity. The goal is to improve the quality of life, reduce caregiver dependence, and accelerate rehabilitation through advanced, accessible technologies.
Disabled or elderly patients face challenges in mobility and rehabilitation. Limited movement restricts their independence and slows recovery, creating a pressing need for innovative assistive solutions.
Clinical problem statement 10. Design a portable physiotherapist mechanical device or tool to prevent back pain in person attending the patient during physical exercise in physiotherapy session. Description of the problem is: design and develop a portable device measuring ECG to enable early detection. So this is the problem: design a portable physiotherapist medical device or tool to prevent back pain in person attending the patient physical exercise in physiotherapy session. The video of the problem is:
physiotherapy sessions often require therapists to maintain awkward postures for an extended period of time, placing significant stress on their back muscles and leading to back pain over time. Your challenge is to design a portable mechanical device or tool to help prevent this back pain from happening.
Clinical problem statement 11. Design and develop a portable device for measuring ECG for early recognition of heart disease in patients. The description is design and develop a portable device for measuring ECG to enable early detection of heart disease in patients. The device should be able to provide accurate real-time monitoring, be easy to use and suitable for home and clinical environments. It must allow for early recognition of cardiac abnormalities, transmitting data to healthcare providers for timely analysis and intervention. The solution should be affordable, reliable, and contribute towards improving cardiac care accessibility, especially in underserved regions.
Hey there, Hackathon warriors, ready to dive into a challenge that could genuinely save lives? Let's talk about creating a portable ECG device for early recognition of heart disease. Now, why is this so crucial? Heart disease is a leading cause of death globally, but early detection can make all the difference. With a portable ECG device, we can bring hospital-grade monitoring right to where people are, whether
Clinical problem statement 12. Wearing early warning system for heart conditions. Design a wearable device that can detect early warning sign of cardiac events and notify both patients and healthcare providers instantly. Description: wearing early warning system for heart conditions. The solution should be able to save lives by making preemptive arrangements for the patient care. The video of the problem is:
conditions can strike without warning, but early detection can save lives. Introducing a wearable device that monitors your heart in real time, detecting early signs of cardiac events like arrhythmias or heart attacks. This advanced system instantly notifies both the patient and healthcare providers, allowing for immediate action. Compact, comfortable, and always connected. This device ensures you're never alone in monitoring your heart health. Empowering patients, informing providers, and saving lives. This is the future of cardiac care.
Clinical problem statement 13. Sterilization device. Create a compact portable device that can effectively sterilize medical instruments or surfaces in real time to prevent hospital-acquired infections. The solution shall help prevent lot of complications that arise due to such infections carried by patients and visitors of the patients.
Fast-paced healthcare environment, sterilization is essential for patient safety, but traditional methods are often slow, inefficient, and can lead to dangerous delays. Now, there's a better way. Introducing a portable device that sterilizes medical tools and surfaces instantly, ensuring safety when it matters most. Compact, easy to use, and efficient, this device brings real-time sterilization to every corner of healthcare, ensuring infection prevention, one instrument at a time.
Clinical problem statement 14. Improve telemedicine devices. Design a telemedicine device that allows for more comprehensive remote physical exams, such as devices that transmit high-quality heart and lung sounds or high-resolution imaging for skin conditions. The patient shall be monitored from the comfort of his home and preventing the time-consuming visit to the doctor's place.
Medicine has transformed healthcare access, but there are limitations when it comes to conducting comprehensive physical exams remotely. Introducing a breakthrough in telemedicine, a device that captures high-quality heart and lung sounds and provides high-resolution imaging for skin conditions. With advanced sensors, doctors can now conduct comprehensive remote exams, improving diagnosis and care, all from the comfort of the patient's home. Portable, precise, and user-friendly, this device makes quality care accessible to everyone, everywhere. Revolutionizing remote care, bringing the doctor's office to your home.
Clinical problem statement 15. Rapid point of care testing devices. Innovate a device that can provide rapid, accurate point of care testing for conditions like infections, function, etc. Minimum blood or tissue samples and immediate reporting to healthcare provider. Often the delay in actionable results due to lengthy lab test times, traditional diagnostic methods require large samples of diabetes, which can be slow and inefficient, especially in urgent care situations. This lag in diagnosis impacts patient outcomes, leading to delayed treatments, longer hospital stays, and increased healthcare costs. Additionally, rural or low resource areas lack access to such facilities, further limiting timely diagnosis. There is a need for a fast and accurate and portable testing device that can provide immediate, reliable results at the point of care.
In today's fast-paced healthcare world, time is critical. Every second matters, especially when diagnosing serious conditions like infections, kidney failure, or metabolic disorders. Traditional lab tests can take hours or even days, leading to delayed treatments, increased anxiety for patients, and more burden on healthcare providers. What if there was a more efficient way?
Clinical problem statement 16. Non-invasive and harmless device to monitor or detect blood sugar levels in a neonate. It is very difficult to use invasive methods on newborns to take the samples for various kinds of tests. Solution to the problem will bring a lot of relief to the parents and the newborn in preventing the invasive procedures for the basic monitoring of vitals of the newborn.
90% of premature babies face health risks due to unstable blood sugar levels. Every year, thousands of newborns face a hidden challenge: unstable blood sugar levels. Current methods are invasive and stressful for these tiny fighters. But what if you could change that? We're calling on tech enthusiasts to bring their brightest ideas to develop a non-invasive, harmless device. It's time to innovate and make a real difference. Ready to be a hero? Join us and let's create a safer future for every newborn.
Clinical problem statement 17. Smart wearable devices for anxiety detection during dental procedures. Description of the problem. During dental procedures, a patient has to be seated on a special dental chair, and this chair, along with the needful equipment of dentist, is an altogether different experience for the patient. Generally, for elders, it is an acceptable situation. Sometimes it is a panic situation for even old age people and children. There may be an anxiety and related issues with patient undergoing treatment. An innovative solution could pre-sense the problem and give the indication to the dentist.
If your dental visits feel like a horror movie, you're not alone. Anxiety at the dentist is real. Many patients experience anxiety during dental procedures, making comfort and cooperation difficult. Untreated anxiety can lead to negative experiences, complications, and even avoidance of essential care. Current tools fall short in real-time anxiety detection, leaving dental teams in the dark. That's why we need smart wearable devices to monitor anxiety levels and provide instant feedback. Imagine less stressful visits and better treatment outcomes. Revolutionize dental care with smart wearables.
Clinical problem statement 18. A smart device designed for neonatal and premature baby care. The description of the problem. For premature babies in rural areas, it is very difficult to manage the incubators for the child to provide an ambient environment after birth. The cost of incubators is also a very costly affair. An innovative solution shall be able to provide a lot of relief to suburban areas and also for those who are not able to afford such facilities.
Caring for your tiny warrior just got a whole lot easier. Monitoring premature babies can be challenging, but our new smart device is here to help. With real-time vital signs tracking, precise temperature control, and early distress alerts, it ensures the utmost care, whether in the hospital or at home. Easy to use, incredibly safe and designed to improve health outcomes. Give your little one the comfort and care they deserve with our game-changing technology.
Clinical problem statement 19. Design an alternative for patients with prolonged stay on bed to avoid bed sores. Description of the problem. We know bed sores by different names. The issue is really very common and still we do not have the appropriate solution to this. Though the mattresses are available for such patients, but what about the older ones who live with us and are at bed rest? Having the separate mattresses for the older ones can be expensive and may not be suitable for all. Your turn to choose the comfortable with, and for that we have that I will be sharing in the next slide. You have to wherein you have to enter some required information along with two choices for the problem statements that you want to fill this form. After that, this form will stop accepting the request. So your time starts now.
Yeah, engineer. Yeah, आसान है. So this is the first time engineers and doctors, every group will have 2 pharmacy or medical or paramedical students. Don't worry, they will help you with it. So just fill up 20 problems, you have to choose only 2. So much.
Proceeding towards the end of the inaugural ceremony, and where we begin 2 days hackathon filled with positivity and motivation. Now I would like to request Dr. Medha sir to kindly present the vote of thanks.
Good morning, Honorable Director General Ma'am, Joint